I want us to imagine a small boy who grew up in a village in Sierra Leone. He wakes up one morning complaining of fever, headache, pain in his lower limbs, and vomiting. The family members and those around this little boy believed he is the victim to witchcraft. And so they couldn't take him to hospital for medical attention. After several traditional practices and herbal medication, his symptoms worsen, and he eventually loses the use of his lower limb. This boy is my biological uncle. I later learned that his symptoms were not caused by witchcraft, but due to the polio virus. This revelation really changed my perspective and spurred my desire to pursue a degree in community health. It made me realize the profound impact cultural beliefs can have on health, and the importance of shifting these norms to achieve health systems that are resilient to the external shocks that impact the achievement of good health and well-being across the globe. We all know the progress to achieving good health across the globe is by no means equal. For example, the health system of my country is still struggling to provide the basic primary health care services for its citizens. But however, since I was a boy, I have seen even bigger and sometimes almost invisible barriers to good health. And these barriers are normally related to social, to cultural, religious, and gender norms, which perpetuate negative attitudes and practices and have a profound impact on the achievement of good health and well-being. Back to the story of my uncle. Of course, he was really helped by an Irish priest in those days, in the 70s and 80s. Of course, the priest died back home in the Civil War. But his story really is a stark reminder of how entrenched beliefs and cultural practices can impact health in the global south. I know, or we all know, that achieving universal health coverage cannot be achieved in isolation, that we need to bring everyone on board, those in the global south and in the global north. Women and girls in our country are the most deprived people in accessing healthcare and good health. And these systems are really compounded by poverty and social and economic exclusion, especially for girls and women, which perpetuate their vulnerability and poor health. But my question for all of us here today is, how do we improve, or how do we overcome these cultural barriers in the global south and improve the healthcare while respecting the cultural beliefs and practices of the communities we work with? Well, from my experience in working with GOAL, I have learned that there is a way to empower communities with the required knowledge and skills to be able to adopt positive behaviors that will influence the negative norms and effect the necessary change. Whilst the belief around witchcraft have been slowly shifting over the years, and most people now have a better understanding about the causes and facts around common illnesses, and yet there are still some entrenched norms that continues to be barriers. These norms are social, cultural, and gender norms that many people are not even aware they have. Like gender inequality, gender-based violence, women's lack of power to make decisions in their relationship, stigma related to the uptake of contraceptives for our young girls. These are some of the examples of how cultural barriers affect our health system in the global south. And what do we expect all of us here, as individuals or as authorities, as decision makers, to do in mitigating this? As we all know, Sierra Leone must have gone through some critical hurdles in terms of our civil war, in terms of our COVID, our Ebola, and yet that didn't prevent people from doing what they should be doing to achieve or to contribute to the attainment of universal health coverage. With this support from GOLD in our different operational areas, we've seen how this has contributed to the attainment of reduction in adolescent pregnancy and child marriage in our operational areas. We've seen how girls who are dropped out of school, we are able to return to schools and universities. We've seen how religious leaders, due to our continuous community engagement, we've seen how religious leaders are now speaking openly about certain topics related to reproductive health. We've seen the increased awareness on gender-based violence and other harmful traditional practices. I am here today in Ireland to study with support from the Irish Aid. I, of course, want to really recognize the tremendous support from the Irish government through the Irish Council for International Students, which is IGHNx, and the people of Ireland for their tremendous support in giving me and other Sierra Leoneans the opportunity to become global health leaders and specialty in other disciplines. I'm really optimistic and hopeful to return to my country to make or to effect the necessary change. I am passionate about making a difference. How do I advocate? How do I design health promotional programs that will contribute to mitigating some of these barriers within our health system? I therefore call on all of us here today that we must not underestimate the power entrenched beliefs and tradition have on our health systems. We all know that by putting communities at the center of what we do brings empowerment and sustainability. Yes, whilst we are trying to overcome these cultural barriers to our health being, we must also not forget to address some social norms by possibly promoting the educational systems in those countries. How do we continue to empower community stakeholders? And of course, how do we implement policies that address some of these cultural barriers that have been mitigating or impacting the access to universal health coverage by either our girls and by our women, who are really vulnerable due to their poor health, due to their poverty, and other social exclusions. I believe if we all come together, we can make a difference, and we can make people closer to achieving universal health coverage. I therefore call on all of us here today that we must join this fight to make this vision a reality. I thank you all, and I God bless the people of Ireland. Thank you.